Today I'm going to perform our turn demonstration about arterial blood puncture. So the first thing that we're going to do before performing percutaneous puncture is to perform first a test, which is the modified Allen's test, to determine whether there is a collateral circulation of the patient's artery. So by doing that, you should let the patient close his fist tightly. So tightly until the color is gone or until his hands will blanch. See, like Korean. Sir, ani sir, close yun sir. Ano sir? So put a pressure using your fingertips on the ulnar artery and radial artery. So, next one is to relax the patient's hands. So, and release the ulnar pressure. So, the color should return within 5 to 10 seconds or 15 seconds. And now, there is a good collateral circulation of his ulnar and arterial artery, radial artery. And so the first thing that we are going now to do after the modified Allen's test, wash hands. So washing hands will reduce the amount of microorganisms residing on the surfaces of your hands. Next one is to read the doctor's order to obtain pertinent data. And now we are going to instruct the patient about the purpose, the procedure, and responsibilities, because information may elevate hyperventilation that when present may alter blood gas values. So, hello sir. I am your respiratory therapist on duty. And now, magkuha tayo ng dugo mo sir. So, it may be painful and uncomfortable, pero I will do my best para hindi masyadong masakit sir. So, kadali lang man niya sir. So, ay kabala ka sir kay dali naman niya siya. And next one is to select site. So radial artery is used as first choice, except in cases when there is a multiple radial artery puncture, occlusion of ulnar artery, and history of circulatory impairment to extremity or cardiac arrest. So the radial artery is a small artery. However, it is easy to stabilize, for it passes through a bone groove located on the wrist. So the percutaneous puncture or pressure control is enhanced by anatomical landmark. After that is you're going to position the patient. So use our semi-recumbent position, and then you're going to elevate and dorsiflex the patient's wrist slightly using small pillow. This deflection of wrist moves the artery closer to the skin surface or surface of the skin, and that way it can be easily to palpate. And next one is to rotate the patient's hand to until the pulse is palpable. So sir, likod lang tayo sir. Ayan siya pangikod sir. So, ano na imong hangin? And then, ano sir, paano sir? Ay, relax lang sir, relax. Relax. Dorsiflex, yan. Tweet lang sa tuyo. Rotate lang. Rotate na po sir, because rotate lang sir. Next one is to heparinize syringe and needle, and use a small or a short 22 gauge short bevel needle on syringe. A short bevel needle reduces the risk of overshooting the artery during entry. Next one is to prime the syringe and needle with heparin, leaving only enough heparin to fill the dead space. So, priming the syringe with heparin prevents specimen coagulation, and however, any heparin excess that needed to fill the dead space will lower the pH and partial pressures of carbon dioxide in the arterial blood. So next one is to eject air bubbles from syringe. So air will may alter the accuracy of the blood gas values. And after that is you're going to prepare the site and fingers used to palpate the site. So I have here my equipments needed. So we have here a syringe, use here after the alcohol swab, 2 alcohol swab, and a povidone iodine. And I have here my gloves. So what you're going to do here is to cleanse the selected site in a circular motion outward with povidone iodine swab and then allow to dry. After that, because drying a povidone iodine solution reduces the risk of local infection or systemic sepsis. Next one is to cleanse the site with alcohol swab and then allow to dry. So alcohol removes the povidone iodine solution from the site and it will enhance the visibility. So when you are going to puncture a moist alcohol prepared site, it can increase the pain to the patient. I will now put my gloves in order to protect myself from possible bloodborne diseases. Wait. Oh my gosh. Sir, relax lang, sir. Then we're going to allow it dry. And after that, we're going to cleanse it with alcohol to remove the povidone iodine. Okay. And now, I am ready for a percutaneous puncture. So perform a percutaneous puncture on selected site. So you're going to locate the pulsating artery and then stabilize the artery by pulling the skin taut and bracketing the maximum area of pulsation with fingertips or free hands. Next one is to perform a puncture on the skin with holding the syringe like a pencil, and then advance the needle slowly with a bevel upward approximately 45 to 60 angle to radial arteries. So a slow thrust or a slow gradual thrust will promote arterial entry without passing through it, and enter at angle is comfortable stabilizing your hand, but entry angle is not important. So the most important is the certainty of position, or the certainty position of your hands. So next one is to observe for flashback of the blood. So flashback is easily, it is easily or it is readily available with glass syringe, and gentle aspiration may be necessary with plastic syringe. So you're going to know if the I mean the blood has been, or the artery has been punctured, if the pulsation of blood, if you can feel the pulsation of blood into the syringe, if there is a pulsation of blood into the syringe. So if the puncture is unsuccessful, just draw the needle to skin level, and then you're going to um, angle slightly. So you're going to angle slightly toward the artery, and then re-advance. Next is to obtain 1 to 3 ml of specimen. This amount of sample allows for rechecking and additional studies if necessary. Next one is to withdraw the needle and while stabilizing the barrel of the syringe. So this prevents advertent aspiration of air during withdrawal of needle using a glass syringe. Next one, after that, you are going to apply a firm, continuous pressure on punctured site for 5 minutes or until the bleeding stops. So hematomas following after a puncture, after an arterial puncture, will can cause circulatory impedance, discomfort, or can predispose to infection. So for patients who have an increased coagulation time, apply firm pressure for 10 minutes, and for patient who has a persistent bleeding, so apply an ice pack. So now we're going to perform a percutaneous puncture on the selected site, which is the arterial or the radial artery. So open it, and then so hold the syringe like a pencil, and then stabilize first or locate. Then after you're going to locate the pulse, you're going to draw the puncture the skin slowly. Hold the syringe like a pencil, and then advance the needle slowly with bevel upward, approximately 45-degree angles. So if you can see a flashback, so that's the time when the pulse has been punctured. Next one is to draw the needle to get them. So you're going to obtain 1 to 3 ml of specimen, and then after that, if you already obtained 1 to 3 ml of specimen, then you can now draw the needle for stabilizing the barrel, and then apply. Slowly draw the needle, and then apply a firm pressure for 5 minutes. Then after that, you are going to protect the sample. Hold the syringe upright, and then express air bubbles rapidly. If you can see air bubbles, express those air bubbles, because it will alter the result of the laboratory test. And the specimen should be kept airtight, so that or to prevent alterations of the test results. Next one is to seal the needle with rubber stopper or cap, and then you're going to use a Fisher technique. So you're going to use this one, and then that one after that, and then after that is to roll the blood sample gently to mix the heparin and blood. We're going to roll gently, gently roll to mix the heparin and blood. And then you're going to, after the firm pressure, you can now put something like this, so that to secure This one. And after that, you're going to immerse the blood sample in enough ice for laboratory transport. So assuming we have here our ice, and then we're going to put this one here. And after the use of ice reduces temperature of sample to below 40 degrees Celsius and will slow the metabolism of oxygen, and also a delay longer than 2 minutes will alter the result of the test. After that, you're going to label the specimen. You're already transported this one. You're going to label the specimen, complete appropriate laboratory acquisition, and you're going to note the percentage of oxygen therapy if applicable, the temperature, especially when elevated, and also the time the specimen was drawn. So specific information from sample collections or related to sample collections enhances accurate analysis of results. Next one is to expedite immediate laboratory services. No test results of any specimen, even if chilled, is accepted as reliable if sample is tested for more than 15 to 30 minutes after arterial puncture. And after those after performing percutaneous puncture, you can now you are now done with it. So thank the patient for his cooperation, and that's all. Thank you. Thank you, sir, for your cooperation, and inform na ka naman sa results, sir, ha?
Yes.
Thank you.